diagnosed with hypothyroidism and I was started on medication. After a while, I stopped the medication. Should I restart the medication? What are the indications for taking thyroid medication? Well, first of all, before starting any medication, I always recommend check if you actually need the medication. I've talked about if you're diabetic, make sure you check your hemoglobin A1C. If you are thyroid or have any thyroid disorder, the first thing you want to do before you consume any medication is to check your thyroid level. So what blood test should you do? You want to do the TSH, that's the thyroid stimulating hormone. Now that hormone stimulates the external hormone which circulates in your body, which is the T3 and the T4. When you're taking thyroid medications, you're actually taking medications that are the T3 and 4. So it's important that your blood tests include T3 and T4. And they have the bound and they have the free. So if you really want a picture, what most doctors will do is do what we call the screening TSH. So they'll only do the TSH level. And if it's high, believe it or not, it means your thyroid is underactive. And if the number is low, that means your thyroid is overactive. The purpose of the thyroid is to control your hormones. I say, well, which hormones? It controls the ones for whether you have energy or you feel tired all the time. It controls the hormones that makes you sleep or not sleep, whether you're hot, whether you're cold, whether you gain weight or lose weight. So it's very important that if all of a sudden you start feeling you're gaining weight and there's no reason, you're not changing your diet, you haven't adjusted anything and you start gaining weight, it's a good idea to check your TSH level, your screening. Now, once you've been diagnosed and you may have started medications like the person who sent the question in, you want to monitor T3 and T4 to see whether or not you're getting too much or too little of the medication. So first place you listen is your body. Are you sleeping every time you fall in a chair? Or are you just so hyper that you can't sleep? Are you getting palpitations? Those are signs that something may be going on with your thyroid. But if you feel fine, you're eating all right, you're not gaining weight, you're sleeping well, more than likely your thyroid's fine. And if you've stopped and your blood tests are normal, there's no reason to restart the medication. Even with a goiter. So how does goiter? A goiter is a swelling in the thyroid area, which is right in the neck area. It starts to grow and sometimes it looks a little full in this area. Also, we have individuals whose eyes may start to look bigger and start almost bulging. Those are signs that there may be what we call having thyroid toxicosis or having a thyroid storm. So it's real important. If all of a sudden your eyes look different, and now there's a commercial for it, that they can get rid of it, your eyes start looking different, your neck starts swelling, you can actually feel something in your neck, it's really important to get an ultrasound of the thyroid. And sometimes the thyroid blood levels will be normal, but you'll have this large swelling in your neck. The ultrasound will reveal whether or not you have a nodule or a tumor of that thyroid gland, which can have a possibility of a cancer. So don't ignore any new swellings anywhere on your body, but especially if we're talking about the thyroid in your neck. So step one, evaluate, do I feel different? Tired, sleepy, energy, no energy, palpitations. Step two, do the screening test, your TSH. Step three, if you have a swelling in your neck or your eyes, get the ultrasound. Get an eye exam for your eyes. And finally, don't stop any medication unless you're under the supervision of a physician. Have that conversation. Hey doc, I don't feel like I need to take this medicine anymore. Could you check if I need to do this medication? That's an okay question to ask any practitioner that you call a family doc or a PCP like myself.
Okay, I did that.
Any other questions? Menopausal. The true definition of menopause is if you have not had a period in over 1 year. Not 3 months, not 4 months. That's called pregnancy. No, I'm kidding. If you haven't had a period and you're in your 40s, and it can happen earlier, but typically your late 40s, in your 50s, if you have not had a period for 1 entire year, you're considered what we call menopausal. Now, you're menopausal, no period for a year. 2, 3, 4, 5, 6 years go by, and all of a sudden, you start having a period. It may not even be a full period, but spotting, seeing blood stains, red light, alarm, pay attention. There's a condition called postmenopausal bleeding. You should not be bleeding. So why would you be bleeding? First of all, we can't rule out any kind of trauma. Have you put anything inside the vaginal area that might cause the lining to bleed? When you're menopausal, the lining of the inner lining of the vagina is very, what we call friable, right? What that means that it's easy to bleed. It's easy to be irritated. It gets very dry. So I always recommend in my Sex 101 class that lubrication is a really good thing if you're going to engage in sexual activity. Especially if you're going to be using things like a dildo or any other toys in your sexual activity. You definitely want, if you're postmenopausal and you have vaginal dryness, to use some kind of lubrication. But if that's not the case, I ain't having no sex, Dr. Powell, I don't know why I'm bleeding, then we ruled out any kind of toys or any penetration issues. You're just bleeding. So the next question, have you started any hormones? Have you started any hormones? Because sometimes it's a good cure for hot flashes, the vaginal dryness. Taking bioidentical hormones or hormones will help with the dryness. It will help with the vaginal atrophy. Have you started it? It's very possible that maybe it's too strong, it's too low, and it's stimulating you to have a menstrual cycle again, right? No, I'm not taking any hormones. So then we got to go to step 3. What's going on in the lining of the uterus? The lining of the uterus, when you are menstruating, every month thickens, and when there's no baby, it sheds. That's called your period. So Mother Nature makes it thicken to get to receive the sperm cells and the eggs so that it's like glue. It thickens to catch those cells. Now here's the problem. If it has no cells, it has no sperm cells, and they make an egg and fertilize, then Mother Nature says, whoops, start over. So it sheds the lining of the uterus. And that's normal, that's a normal menses. But now you haven't had a period and you're postmenopausal. You should not be shedding that lining anymore. And that's what we call postmenopausal bleeding, and we have to check for a condition called cervical cancer. I'm sorry, not cervical, endometrial, the lining. The cervix is the door. I always tell you it's the door to the uterus, right? So make sure you get an endometrial biopsy. Go to see a GYN, and it's just like going into getting a PAP. They're gonna put you up in stirrups. They'll put some medication on the cervix. They'll do what we call a dilation. Not comfortable, don't let nobody tell you. It is not a fun test. And if you got some Tylenol, I'll tell you, take some before you go. If you can take Tylenol. It's not a fun test because they're going into a very closed area. And by the time you're menopausal, it becomes what we call stenotic, which meaning sealed because nothing's coming out of it anymore. So once it gets stenotic, it's really hard to open. So they put in a device to open it a little, not comfortable. They go inside, do a little scraping with the device, and take a sampling of the cells. And they send it to pathologists and see whether or not those cells are turning into cancer or not. Do the test, even if it's uncomfortable. Take 2 Tylenol, take 2 Tylenol afterwards, because early treatment for endometrial cancer will save your life. There's no reason in 2023 for us to be dying of endometrial cancer.
Okay, so at my age, I haven't had a pap smear in 500 years, okay? It's been like 500 years since I had a pap smear.
500 years old. Yeah.
Well,
Do you need one?
I don't know.
Okay.
From up north, my mother went every year till
Yeah.
we came south. My grandmother went every year till we came south.
Good.
But I was asking my doctor, do I need to have a pap smear? And she said, well, when you get a certain age, they say you don't need it. Why is that?
Okay, so good question. The next question that was come to me is, well, when do I stop taking a pap smear? You know, do I really need a pap smear if one, I'm not having sex, two, if I'm not even trying to get pregnant, and three, if I don't even have a uterus? So let's address every single reason. The first thing we have to understand is, why are we doing pap smears? The purpose of doing a pap smear is to make sure you don't have cervical cancer. We know that once you become sexually active, 99.9% of the people who have cervical cancer have been sexually active. And the most common cause of cervical cancer is HPV. HPV. That's why now they have the vaccine that children can get from 12 years old, boys and girls, and all the way till 28. It's recommended vaccination to prevent cervical cancer. So at our age, postmenopausal, we didn't get that vaccine, right? We didn't get it. It wasn't around. But if you're young enough, get the vaccine, because HPV is so common, especially if you're sexually active. Because once we get sexually active, you run the risk of cervical cancer. That's to the door we're talking about, right? And so the good news, again, 2023, we can cure cervical cancer. So the purpose of the PAP is to look at the cervical wall, which I always use my finger, this area, the opening of the uterus. And if any abnormalities exist, when they take that scraping, they're able to identify whether there's cancer there or precancerous lesions that can be treated, right? So then, well, how often should I get one? They've changed the recommendation so many times. They'll say, well, you don't have to get one until you're sexually active. Then they say, well, if by 21 and you haven't had a PAP, even if you haven't been sexually active, you need to have one. And I'm gonna leave it to the discretion of the person, because if you're not sexually active, never had sex before, we know your chances of getting cervical cancer is almost non-existent, right? But I do have people say they never had sex, and they have. So if you're sexually active, be honest with yourself and make sure you get screened. Now here comes the next question. Well, how often? You know, so the recommendation is now, if you've had normal PAPs, 1-2 years, they're normal, they're recommending 3 to 5 years before having another one. As long as you've had normal PAPs, you can skip a couple years. And I know people get really embarrassed, look at Dr. Powell, I had one in a year. Don't worry about it, as long as it's been normal. But if you've ever had an abnormal PAP, it's very important that you follow the cycle. Usually it's every 6 months to a year to get that PAP, to check to make sure it's not changing from abnormal cells, or what we call atypical cells, to cancer cells. Early is better than later. So let's move on. What if I had a hysterectomy? Do I need to have a pap smear? Well, no, you don't need to have a pap smear because you don't have a cervix. We're trying to find cervical cancer. And if there's no cervix, we're not looking for cervical cancer by doing them. Now, there's a thing called pelvic exam. Do you need a pelvic exam? Well, any discharge, any change in the fluids coming out of the vaginal area, run to the doctor. You should not have yellow, green, smelly discharge coming out of the vaginal area, right? Even if you don't have a uterus, whether it's partial or total hysterectomy. If there's no cervix, no need for a pap test, but there may be a need for a pelvic exam, which is look and check what's in there, right? Now, well, we talked about, well, now I do have my uterus. I'm not menopausal, I don't have a period. Do I still have to get a PAP, even though I'm not sexually active? The answer is, and it's new now, 65, they used to say 75, now they're saying 65. It's at the discretion. Negative, you don't need it 3 to 5 years. You can stop at 75 or earlier if you're not sexually active. But my rule, and this is just according to Dr. Powell, okay? If there's any changes, check it out. If there's a change, If you haven't had discharges, and all of a sudden you start having yellow-green discharge, check it out. If you find that you're bleeding, check it out. Never let anything unusual go without evaluation. And so that's my recommendation. I hope that answers the question. So you have another question has come in. Yes.
Locked again.
So
But someone was asking online if menopause affects weight gain and weight loss.
ooh, child.
And also they say it's been 6 years and they still are having problems. So Mocha Gray asks, is it harder to lose weight 6 years and counting, not having any of the symptoms you described? Basically, I feel the same. Losing weight is my only struggle. Could this be from menopause? And you were talking about removing your uterus or having your hysterectomy or so on and so forth.
Ooh, child. Good question. You've reached into my life, girl. My girlfriend just asked, I'm menopausal, haven't had a period in a while, had a hysterectomy. Struggle bus. I'm still having symptoms. Hot flashes or no hot flashes. Just weight gain. Yes, yes, and yes. Menopause has some side effects that will make you want to holler. Okay? When I say holler. Yes. Okay? And number one is weight gain. I'm gonna be 100. I gained 20 pounds when I started menopause and went through cancer treatment. They shut down the estrogen. So we have to know what menopause is. Menopause is when not just stop having a period, but there's a reason you have stopped having a period. It's because your hormones have changed. Your estrogen has dropped, right? I went through menopause at 47, okay? And I hot flash day and night and day, and it's not hot. It's not like the room is hot. The hot flashes comes from inside out, like you about to go in flames, like poof, and then you freeze down, poof, and then you like refrigerator. I know that people can relate to this. And then you'll be laying there in your bed, nice and calm and feeling good. Then poof, and then you take your clothes off and you're sweating and your hair be getting messed up. And then all of a sudden you're cold. Give me my radiator. And it just goes on and on. And then to top it off, you start gaining weight around the belly, the hips, and the behind. And you can't tell the difference between your stomach and your hips because they all become one. Yes, girlfriend, I feel your struggle bus.
I know that's right.
The loss in your hormones, the change in those hormones does make a difference. So let's get to the real, okay? There's no forgiveness after 50, okay? So stop trying to act like you're still 24. You have to do more to stay in the same place. So don't think you can eat a nice big happy meal and not gain the weight. Because struggle bus menopause and postmenopause says you're gonna pay the price, okay? So you need to be different when you go through menopause. You need to get your sleep, and if it needs adding a supplement, because the hormones affect your sleep patterns. You wake, you sleep, you wake, you sleep, you're hot, and that makes you gain weight because of increased cortisol levels, right? So that means if you need a supplement, a melatonin, a tryptophan, some chamomile tea, run around the block for a little bit and don't eat 2 hours before, you have to do that. You have to be different in menopause. You cannot consume the same calories you consumed in your 20s and your 30s because in your 20s and 30s you had estrogen. It was burning up that junk food. It was burning up the fast food. Well, you're not that person anymore. Let it go. You're not going back. You are now newly menopausal with a decrease in estrogen. Your thyroid function may be off. That needs to be checked. So you have to be different. What I find very concerning is that as we get older, we want to be more sedentary. That's the worst thing we can be. Our jobs have us at our desk longer. We're sitting on the couch. We're sitting on chairs. Everywhere we go, we're looking for a chair. And we didn't do that in our 20s and 30s. We had no problem walking to the bus, walking to a friend's house, walking. We were always moving, and that movement helps to maintain weight. You go through menopause, you ain't got no chairs in here? I'm out of here. You got 15 minutes for me to be here. Nobody wants to stand, and movement Where's the car? Let's get the car. Bring the car around. Won't even go to the car. You gotta bring the car around. Those little tiny pieces affects your weight. So just remember, for menopause, in answer to the question, no forgiveness after 50. You need to do more to stay in the same place. And if you want to lose weight after menopause, you must see someone like myself, who has created an entire weight loss for life program that really works with people who have hormonal changes, who requires additional and customized nutrition as well as exercise program. Because it's true, as you get older, the joints start to ache and bake. I call them ache and bake, you know, and you need to have different exercises, but you do have to move, right? You have to move. You have to treat your body differently after menopause. You can't treat it like it's 20 and 30 years old.
But I've gotten lazy.
Yeah.
I don't wanna get out of bed.
I feel you, because it feels good. Man, it feels good, right? But you can't, you gotta be like the little 2 and 3 year old. Mommy, 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 get up, get up, get up, get up. And they're ready to go, and you gotta move like them if you wanna look like them, right? And you have to do it a little differently. Yeah. Yes.
Okay, so you did a video about the first place you lose weight in the back of your tongue.
Gain weight, gain weight.
Gain weight, yeah, gain weight in the back of your tongue. So somebody wants to know, when someone stops snoring, does that also mean that they lost weight?
Well, there are a lot of reasons why you stop. Well, first, you snore because of the opening at the back of your throat. If the back of the throat opening gets narrowed, or if you have a sinus infection where you're congested because ear, nose, and throat are connected, then when you lay back to sleep, the tongue falls to the back and it makes the back of the throat more narrow. So as you gain more weight,
You ever heard people talking like this? Because the weight around their throat is just
preventing them from speaking because you're cutting off the airway, right? So as you lose weight, you're going to also lose weight in the neck area, and that area should open up. So weight loss is one way to get rid of snoring. The other way is using a CPAP mask. And another way is to actually have surgery. Some people might have surgery to open that space so that air will flow better. Yes.
Somebody wants to know, does that also have anything to do with a double chin?
Well, 2 things cause double chin, okay? Maybe 3. Number 1, of course, is weight gain. You know, a lot of people look at the waistline as a place for weight gain, right? Some people just gain it in the boobs. Women, there are a lot of women, they get pregnant and they barely had a little bump, but the BBs got this big, and a lot of the weight went there. But there are other people who get into the flappers, what I call the flappers. Their arms, they get the back fat, right? They get the weight back there. Or some people get in the boobie, in the butt, right? But here's what happens. All that excess weight that you see on the outside is also happening on the inside. It's surrounding the heart, it's surrounding the liver, it's surrounding the kidneys, and that makes those organs very slow and sluggish. So you really want to keep your weight down as much as possible to make sure your health is really effective. Yes.
Is this the first place fat stores are used when you're on your weight loss journey?
Where's the first place that the stores go?
Mm-hmm.
It depends. Everyone is different. Some people will start losing weight and they lose. Can do 2, do 1. You're activating the muscle that's running from here to here. Just standing, and if you have trouble with balance, just standing and lifting activates the muscle that's running from here to here. But walking is not going to activate that muscle.
No.
So that's one of the reasons you may not see weight
If you're
loss
walking
there.
like a band person.
Yes, you have
Don't
to.
it help get rid of the flat?
You got to activate the muscle. Plus, of course, reduce the mouth exercise. Do you know what the mouth exercise is?
Oh yeah.
You know, exercising the mouth with food. You got to reduce that.
If you run, how long it'll take to like realistically lose weight and stuff?
The question is, how long will it take to lose weight if you start running? Depends how far you gotta go. If you're looking at, like myself, 3 to 4 inches of excess fat around the waistline, that's about a year of work. That's literally about a year of work with a good diet. Weight around the waist, weight and waist requires wait time. You're going to have to give yourself time.
Okay.
So for every inch, I would say give yourself 3 months.
Okay.
3 months for about every inch.
Because I noticed I lost 30 pounds after I had my accident, and it was from me walking, but I walked very briskly.
You gotta be brisk, gotta poof, like you're fighting, poof, 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 and you gotta get that knee up.
30 pounds, but who said that you could sit there and keep it off? I tell you.
Yeah. Always remember, what got you there will keep you there, right? Don't think that you do a weight loss program and stop the program and you're gonna stay there.
Right.
It's like a marriage. What got you the man will keep the man. But if you stop, or the woman, or the partner, but if you stop what got you that person,
It's gone.
okay, it's on you, boo.
All right now.
That's all I gotta say.
Yes, so I can't complain. I really can't.
I do a
Like I
question.
said, when you get to 100, who cares if you sit there and lose?
I have a
weight?
question, and it's just a statement since I'm here talking about things. Pain. Pain is so big, and I just found out that it's been new and it's been coming, but codeine, you know, Percocets and all the oxys and all that, you know, there's been a big push over the last 15 years to reduce the use of narcotics for pain. And I just wanted to make a brief statement about pain. You have to identify your pain before you start treating it. Remember I said, you know, you gotta figure out what's going on. This is just according to Dr. Powell. There are 3 types of pain. We always focus on the physical pain. Like you broke your ankle and you feel pain, right? And physical pain is the easiest pain to treat, right? If it's broken, you ice it, you elevate it, you compress it, you put an ACE bandage on it, give it 4 to 6 weeks of rest, and it usually will heal itself and the pain will go away, right? You put ice on anything that's inflamed and swollen and it will reduce inflammation, right? Because that's where pain comes from. When you injure a body part, your cells flood that area with blood vessels to start a repair job. They send in what we call the construction workers and they start repairing. But while they're repairing, they're putting up, you know, plastic and sheeting and everything while they're working, and that's inflammation and swelling. So you put the ice on, and don't just put it one time. Well, I used ice and it didn't work. Well, that's not how it works. You have to do it for at least, 5 to 10 days straight. Every 4 to 6 hours, put it on for 10 to 15 minutes for the inflammation to work. If you look at the major athletes, when they finish a game, the football players, basketball, they do ice baths. They go jump in that ice water to reduce all that inflammation in their body from the stress of their activity, right? That's physical pain. Compression helps to reduce the swelling also. That's why you wrap it. You elevate to get the fluid from flushing that area. Simple. Ice, elevation, compression, and rest. And this is what I always have issues with. You injure a body part, and then you want to continue to stress it. And then you wonder why it does not heal. If you injure your back, you cannot continue lifting. Right? You can't continue pulling and pushing. You must rest it, or else you will continue to have that problem. So it's a hard, my grandma said, hard is go to market twice. Which simply means you keep doing the same thing, you get the same result. Time to do something different, right? So if you know lifting is going to cause problems, you need to stop until that body part heals. But that's physical. And most medications are designed to address the physical. Tylenol, Motrin, Aleve, topical creams. And by the way, when it comes to topical creams, like a Voltaren or diclofenac gel or Icy Hot, they're very short term. You have to reapply the gel. So don't come to me and say, Dr. Pat, it didn't work. Well, if you put it one time, it's not gonna work. okay? And the prescription topicals take about 2 to 3 days for your body to kick in with it. So you want to reapply it every 6 to 8 hours and give it its opportunity to work. But there are 2 other types of pain that we don't pay enough attention to, which makes the physical pain worse. Number 1, emotional pain. And emotional pain can come from simply sorrow and sadness. You know, one of my people in the audience mentioned they have, their pain is their family, you know? And that pain can make a physical pain worse because it's draining your body of the healing hormones that you need to heal the physical. If you're always telling your mind and reliving that emotional injury, and that's where we have conditions now that move into the mental, like when people have a car accident or have a traumatic event, like maybe a physical rape or that were brutalized. That was a physical harm, but the mental aspect of that pain is that a feeling of fear, a feeling of losing self-control, a feeling of being victimized, right? So the physical may heal, right? You know, the vaginal walls are healed, maybe the arm that was broken is healed, but emotionally and mentally, you're still feeling the pain. You're still reliving it. You may not sleep at night because the visions come to you. And for that kind of pain, because we're ending Mental Health Awareness Month, you must treat it. You must treat it with professionals who are specialized for counseling, and see a psychologist or a psychiatrist. There's nothing wrong with it, because you will find more manifestation of physical pain if you have emotional and mental pain going on. So that's my word on it. Identify your pain, but make sure you treat it and treat it correctly. Yeah.
Ooh, just a little about that. I saw, I don't know, there was a few scientists or whatever, they were doing like a podcast, and they actually measured emotional trauma, and they measured it and said it affects you the same way as physical trauma affects you, and it actually leaves a damaged part in your brain.
Correct.
So like when people like are abusing their kids or family members and they, oh, just get over it, it actually is like you hit them, you know what I mean?
Yes.
And they actually measure that, and that makes sense why a lot of people go into depression for a long time and stuff like that.
That's a very good point. We can, as I say, you can get over a physical injury.
Mm-hmm.
Your body is amazing, it will heal itself. But mental and emotional injury leaves scars. And that scar tissue damages that part of the brain. And you have to get the therapy and the counseling to what I call do the workaround. You know, that highway is shut down. We need to learn how to work around. What can I do to decrease the amount of visualizations that come to me every time I hear a loud sound? And you learn what we call biofeedbacks. There's treatments to help you with trauma. But don't just keep it inside and hold it inside, because it will show up when you really don't realize it. It will show up in so many other things. In your relationships, it'll show up as your engagement with people, the not trusting, not even wanting to drive. People who are in car accidents don't even want to drive anymore, have trouble getting in cars, things like that. So please don't ignore getting the treatment. Okay. All right. We did good today.
You learned something, yes.